Hi, are you someone who experiences a lot of headaches and gradual diminution of vision or blurring of vision, or you are experiencing halos around light? These can be the symptoms of a condition called glaucoma, which is gradually progressive and can leave you with blindness. Hi, I'm Dr. Jatin Wazirani. I am an ophthalmologist specializing in cataract and refractive, and I'll be speaking to you regarding glaucoma today. Glaucoma is, by definition, is a type of a neurodegenerative chronic optic neuropathy which affects your optic nerve, and it is gradually progressive, so you may not come to know about that you are having glaucoma in the early stages, and only when there is significant damage to your vision then you may get the signs and symptoms of glaucoma. So that makes it very important to identify that you are having glaucoma at an early stage so that you can prevent the damage happening to your eyes. It affects your optic nerves and causes gradual loss of your vision, which you may not come to know for a long time. That's why it's very essential, and it is a condition of old age happening after 40 to 50 years of your age. So that makes it important to get regular eye examinations done to catch the disease at an early stage. As such, instead of saying about the causes of glaucoma, glaucoma has risk factors which can be hereditary. That is, if your parents or siblings have glaucoma, so you have more chance of getting the disease. And plus, there are also certain risk factors which are more associated with glaucoma. For example, glaucoma is more common in diabetics. Glaucoma is more common in people having myopia, that is nearsightedness. Also, glaucoma happens at an older age, that is after 40 years. Glaucoma is mainly a disease of old age, and it happens after 40 usually, though it can happen in children also, but more commonly glaucoma affects older individuals. The risk factors associated with glaucoma are generally diabetes, blood pressure, having high glass number, either myopia or hypermetropia are important factors associated with glaucoma. And also, patients on medications such as steroids are also prone for glaucoma if they are on steroids for longer time. See, glaucoma mainly is associated with increased eye pressure, which compresses on your optic nerve and then causes gradual damage of the optic nerve over a period of years. Glaucoma can be classified as mainly two types, depending on the onset and course of the disease. It can be gradual or it can be sudden. Usually, if it is gradual, it is termed as open angle glaucoma, in which the patient may not have any symptoms at first, or may have just mild headache or blurring of vision, or he may notice halos around the lights, or he may notice a blind spot in his visual field. And so that's why it is not detected very early, and usually patients complain when there is significant damage to their optic nerve. And in the other type, we have angle closure glaucoma, which is a medical emergency, and in that, patient suddenly presents with blurring of vision, pain and redness in the eyes, photophobia, watering, and extreme headache and vomiting. And these all symptoms are seen in angle closure glaucoma. No, it is not like that. Glaucoma can affect children also, in which case it is called as congenital glaucoma. It is due to maldevelopment of the eye structures, which cause a rise in the pressure of the eye and affect the optic nerve. But usually it is a disease of old age. It affects people over 40 to 50 years of age. As I mentioned, Glaucoma is a disease which happens over 40 to 50 years of age. So this makes a routine eye examination with your eye specialist very important every year. So routine eye checkup with your doctor can help to detect this condition at an early stage. Your eye doctor will do few basic tests like measurement of your eye pressure and other scans of your eye to detect if you are having glaucoma. He may also check your fields of vision, which is called as perimetry, to detect damage to your visual field, which will become clear if for which you have glaucoma or no. Yes, it can be hereditary in many cases, and in many cases it is sporadic. That is, there is no evidence of hereditary. Stress as such will not have any effect on open angle glaucoma, but it can exacerbate an attack of closed angle glaucoma in a patient who is prone to it. Diabetes is one of the risk factors for developing glaucoma, but it is not necessary that if you have diabetes you will get glaucoma. Mainly glaucoma treatment options start with medical therapy, in which your doctor will prescribe you eye drops which are used to control the eye pressure and bring the pressure down to a target value which is decided by your treating doctor. Many times one or two drugs have to be given to control your eye pressure, sometimes even 3 or 4. And if your eye pressure is not getting controlled with the eye drops, then your doctor may suggest you surgery for glaucoma. Glaucoma as such is a progressive disease, so our aim is to control the disease and not completely cure it. Whatever damage has already happened in glaucoma, that can't be reversed, but our aim should be to stop the progression of the disease so that the patient's eyesight doesn't deteriorate. For that, patient may need to put few eye drops in his eyes as prescribed by his doctor, which can be even for lifelong. So proper compliance on part of patient is very essential, and patient should be motivated regarding the treatment, because the treatment is for a prolonged period of time. He should be regularly in touch with his doctor for follow-ups, and also should report immediately to his doctor if he is facing any side effect of the medications. The most important thing is that the patient should be compliant and properly take the medication on time as prescribed by your doctor, and should take care not to miss any dose. So this was pretty much everything you need to know regarding glaucoma. Still, if you have any queries, please drop your queries in the comment section below and feel free to contact us. Please like, share and subscribe our channel Hexa Health.